Now, let me talk about a couple efforts made at federal level to reform our healthcare system since World War II. Okay, so during the 20th century, several American presidents have attempted or recognized the need for healthcare reforms. Uh, Only Lyndon Johnson's establishment of Medicare and Medicaid in 1965 was successful. So that's something warrants more scholarly work to figure out why Lyndon Johnson succeeded, whereas all others, failed, including Obamacare, partially failed. Okay, and one summary statement about causes of failure is that public resistance and opposition of the AMA, American Medical Association, have hampered efforts at reform. And know that AMA is not the only organization that hampers, but it was singled out by our textbook. So a couple efforts. Right after World War II, President Harry Truman proposed a national health insurance program for all Americans in 1945. So, sounds very much like, Obamacare, right? Let's put that into the context. Okay, what happened to other nations, like the Beveridge model in Britain? Beveridge model is a healthcare system in which the government provides healthcare for all its citizens through income tax payments. And this model was first established by William Beveridge in the United Kingdom in 1948. So succeeded in Europe, right? In 1974, President Richard Nixon began pushing for a national health insurance scheme that was closely tied to the concept of HMO, only to become politically crippled by the Watergate scandal that ultimately forced him to resign. And Nixon proposed that all employers be required to offer insurance, even more authoritarian, sounds like, right? Than what kind of rhetoric in the United States, in contemporary America, kind of hates, right? To offer insurance to full-time employees. Employers and employees will share the premium. Okay, addition of Medicare and Medicaid to the Social Security Act in 1965 marked a new level of involvement in U.S. healthcare by the federal government. Medicare and Medicaid have provided needed health service for the old and those in poverty, where these services were not previously available. Okay, so what is Medicare? Well, Medicare is federally administered program, provides hospital and medical insurance for people aged 65 years or older, regardless of financial resources. Includes disabled people under the age of 65 who receive cash benefits from Social Security. And in 2006, added prescription coverage to benefits. It currently covers 18% of the population. So for Medicare, for the outlay, for the most part. And second is Medicaid. And when we talk about Medicaid, a lot of times also, kind of includes CHIP, that is Children's Health Insurance Program. Okay, this is a welfare program operated by individual states, and states and the federal government to share the cost of healthcare for the poor. Each state is required to cover all needy persons receiving cash assistance. It may also include the medically needy, aged, blind, and disabled poor, as well as their dependent children and families. Right now, it covers 18% of population. So 18 Medicare, 18% Medicaid. Total 36%. Okay, 36%. Now let's talk about Clinton administration. And we know, Hillary Clinton was in charge of healthcare reform during Clinton's administration. Okay, so President Clinton proposed a plan of national health insurance in 1994. Plan failed due to first anti-insurance lobbying efforts, okay, lack of consensus between the Democrats and Republicans in Congress. There's a growing public uncertainty, and but it highlighted the need for reform, and it resulted in reorg of American healthcare into a delivery system in which managed care, later on we'll talk about that, is now the dominant approach in the private sector. So let's talk about managed care. In the early to mid 1990s, private health care shifted away from a largely office-based fee-for-service system to an increasingly group or organization-based managed care system. Okay, and managed care emerged indirectly as a response to the government imposed DRGs for Medicare services. So healthcare providers, lost money to try to kind of cut corners in other areas to compensate for that, right? So what is DRG? DRGs refers to diagnostic related groups. Basically, they're scheduled fees, placing a ceiling on how much the government will pay for specific service rendered to Medicare patients by hospitals and doctors. So here's an example, right? So all the disease, conditions, and treatment are, coded. So for example, MDC, 1 refers to disease and disorders of the nervous system, 2, disease and disorder of the eye, etc. So it's called major diagnostic categories. Then we have subcategories, etc. Okay. So how managed care works, or managed care organization work? All right, they control the cost of healthcare by monitoring the work of doctors and hospitals, limiting visits to specialists within a particular managed care network and to all physicians outside it, and requiring prior authorization for hospitalization. If you remember, we have, I talked about 2 major types. One is what? HMO, the other one is PPO, right? HMO refers to Health Maintenance Organization, and PPO is Preferred Provider Organization. Relatively speaking, patients have a lot more constraints when we go with HMO, but that option is less expensive. And also with managed care, there is capitation fees, that is financing system employed by managed care organizations. There is fixed monthly sum is paid by subscriber and his or her employer that guarantees care to that person and the person's immediate family with little or no additional cost. It discourages inefficient and unnecessary treatment. Well, initially managed care kept rising costs in check. The pressure by physicians, the media, and politicians responding to patients helped dilute cost controls, especially the requirement to obtain approval from a primary care physician before seeing a specialist in many managed care programs. Okay? That made a lot of people unhappy. Okay, so those efforts just discussed reflect efforts made at the national level. Now, I'm getting to efforts made at the state level. Some individual states have implemented their own plans in order to increase coverage. Okay, like Hawaii, right, in 1974 required all employers to contribute to health insurance. Tennessee converted Medicaid into 10-care managed care program. In Vermont, Illinois, Washington provide health care for children with subsidies for premiums. Okay, in Massachusetts requires all residents to have health insurance. If you remember, that's why Mitt Romney and Obamacare, for the most part, modeled after Romney's healthcare system implemented in Massachusetts. Okay, But let's get into Obamacare or ACA, Affordable Care Act. Okay, the 2010 reforms. Okay, despite widespread opposition and concern from various interest groups, politicians, and general public, President Obama passed significant health reforms in 2010. That's called Patient Protection and Affordable Care Act. According to that act, it will take effect full blown in 2014, past tense, right? Estimated that, according to that plan, right? Initially, 95% of Americans will be covered by health insurance by 2019. Few changes for people who already have insurance. Okay. A couple major changes introduced by Patient Protection and Affordable Care Act. Persons with pre-existing medical conditions can no longer be denied coverage because of those conditions. Second, a minimum level of benefits to be set by the federal government must be provided in all health insurance plans. Number three, state insurance exchanges will be established that will offer a range of competitive health care plans at affordable prices. Number four, persons not covered by their employer will be able to purchase coverage through the state exchanges. Number five, persons under the age of 65 who already have health insurance may also purchase plans from the exchanges, and those who earn up to 4 times the federal poverty line, about 88,200 for a family of 4 in 2010, will receive government subsidies to help pay the cost. Number 6, low-income persons under the age of 65 earning below 133% of federal poverty line, that is about 14,000 for an individual and 29,327 for a family of 4 in 2010 will be covered by an expanded Medicaid program. Small businesses can buy insurance for their employees through the exchanges and get tax credits. Number 8, children may remain on their parents' health insurance plan until age 26. Number 9, most Americans, including American Indians, religious objectors would be exempt. Okay, would be required by law to purchase, health insurance or pay a fine, while employers with more than 50 workers who do not provide coverage will also pay fines. Okay, well, several states have joined in the lawsuit to challenge the federal law requiring Americans to have health insurance. And we know the history. Also, Trump made a couple efforts to repeal a couple parts of Obamacare, right? And even succeeded for some accounts. Right?